Welcome to this week's Health and Care update about the coronavirus pandemic in Devon. The latest data indicates cases are continuing to fall across Devon. I'd like to hand over to my colleague now, Simon Chant, who will describe the data in a bit more detail.
This is an overview of the latest national and local data on COVID-19. We start with the national picture. New cases have been declining for the last 2 weeks, having peaked in mid-November. Hospital admissions have started to fall and the growth in the number of deaths has started to slow. In relation to Devon, for the latest available week, there are 666 coronavirus cases and 12 deaths. Case rates were slightly higher in East and North Devon. Devon cases have also been falling in line with the national picture. This chart from our COVID-19 dashboard shows rates have fallen by a third from the peak 2 weeks ago. This breakdown by age group reveals that whilst cases have fallen in most age groups, they have risen in over 80s. This is a pattern that we are closely monitoring. The data in the summary is drawn from Devon's coronavirus dashboard and the National Coronavirus Tracker, which are accessible through these links. Thank you.
Thanks, Simon. So what this means is that while it's really good news, the overall cases are falling, the continued rise in cases in the over 80s is still a concern for us. It's therefore absolutely vital that we do our bit to continue to drive down rates in Devon. Please follow the Tier 2 guidance. Do not meet up indoors with anyone not in your household or in your bubble. And please remember at all times, keep your social distance, wear your face coverings when you're indoors in a public space, and please wash your hands regularly. Now I'd like to hand over to Dr. Paul Johnson, the NHS CCG.
So our local position. Devon has seen lower coronavirus cases and mortality rates than most other areas. But as with other parts of the country, we've seen a clear increase in hospital admissions. There are more people in hospital and more people in intensive care. The good news, though, is that that rate of growth is starting to slow, and that's thanks to the support from local people, from our health and care staff, and from the way that you have all managed to keep socially isolated during that last month of national lockdown. We are really hopeful that this will continue as we enter the Tier 2 arrangements. Although numbers in Devon are relatively low compared to other parts of the country, the virus is still here. It is still infecting people, it is still making people ill, and we must still treat it seriously. You still need to do your bit. You need to follow the social distancing, you need to wash your hands, and you need to wear a mask in public. I'm sure you'll have seen the announcement in the last few days that a coronavirus vaccine has been approved for use in the UK. On the 2nd of December, I tweeted that today is a good day. And it genuinely is, because it offers us a way out of this pandemic. It'll be available within the next week. It has met all those strict safety and quality and effectiveness standards in order to gain its approval. We will make sure that those most at risk from the coronavirus will be offered the vaccine first. And then as we get more vaccines available, we will make sure that that is spread to the wider population. We'll expect more information to be released about the vaccine over the coming days and weeks, and we will make sure that we keep you as up to date as possible as we receive that information. And while the vaccine may help protect people from the coronavirus, it's going to take time before we get everyone vaccinated who needs it. And so in the meantime, I'll reiterate the importance that we continue with what we've been doing so well about the social distancing, about wearing a mask in public, and about washing our hands regularly. Now, as you know, winter is a busy time for the NHS with all of those illnesses that are more common during these few months. And so the NHS has been working extremely hard to keep people safe and to treat them as quickly as possible, whether that be related to coronavirus or to all the other illnesses and infections that we see over winter. In order to help us do that, I'm really pleased that we've launched an improved 111 service, and that was launched this week to give people the opportunity to get the right care at the right time and in the right place. So for Think 111 first, we would ask people who've got an illness or an injury that isn't life-threatening to call 111 or to go online and to be guided by them as to where to get the best care. The clinicians who are available on that call will be able to tell you whether that care should be provided in a hospital, in a pharmacy, or a GP practice, or indeed whether it's something you can do in order to help look after yourself. So thank you for everything that you are doing and you continue to do, because you are keeping your family, your friends, your neighbours, and the whole population of Devon safe during this time.